All right. Welcome, everybody, to the week three of the Resilient Body Workshop Series. Tonight, we're going to go over the lower back. All right. So if you guys can hear me well, you guys can see my screen, just type into the chat. Let me know that you're there, that you could see and hear me clearly, and you could see the resilient back and how to get it slide. Give me a holler there and let me know, because we're gonna get started, folks. Excellent. I got a thumbs up. I'll take that. That's awesome. Let me tell you, the lower back is something near and dear to my heart because I hurt my back in 1985. I was deadlifting in the high school football gym. I did a deadlift, probably 225. It was a huge amount of weight for somebody my size at the time. And that's when I first hurt my back. I felt a pop. And my first foray into the world of physical therapy. And that was not the last time that I hurt my back. It was the first, but not the only time. So I've been dealing with this for a while as well, but I've learned how to fix it myself, and also what to do if it flares up again. So let's get jumping into this thing. All right. So again, this workshop is for you. If you have pain, if your back gets sore after working out, you're afraid to bend over. I've seen some people in my clinic the past couple weeks that have difficulty with bending over, trying to touch their toes, or they're just afraid. And then also, if you don't have any back pain and you want to keep it that way, right? You want to have a healthy back. So some things that you're going to learn tonight is when back pain isn't from your back. It's not responsible, you know. Pain is just a symptom, and it might not be the back that's causing it. One of the sayings that I like to say is that victims scream while criminals stay silent. So if you're working, trying to fix somebody's body like a body mechanic, you know, it's the victim always is making all the noise, but the criminal, the one who causes the problem, is always quiet. We're always looking for where that criminal is. Who's causing the problem? All right, and second one is going to be the one muscle that most people have issues with. They can't control it if they have chronic back pain. And then the truth about x-rays and MRIs, right? All right, folks, this is what's in it for you. You want to reduce your back soreness after exercise. You want to build confidence with moving and loading your spine. It is okay to bend. It is okay to back squat. It is okay to deadlift. It is okay to pick up that milk jug off the ground and put it in the fridge. It is okay to pick up your child out of the car seat and get them into the house. Stuff like that, right? Build confidence and eliminate pain. So that's what you're gonna get out of this tonight. All right, so here's my disclaimer. I gotta read this every week. You know, back pain can be very complex with a variety of causes. But, you know, this workshop, again, like all the other workshops, it's built from advice, general advice that I've given my patients and clients over the past 20 years. It's good general advice, right? But it's for a broad audience. It might not work for everyone, right? So you have to think that if you are dealing with a specific back pain, back injury, contact me, and then we could do we can do an evaluation and develop a individualized plan for you, specific to your needs, right? Another thing that I like to mention is that you never want to bring a fitness answer to a medical question or a medical problem. All right. So some of the things that we're going to be going over today are going to be exercises and drills that might be fitness based, but if you're having a medical issue, they might not be the right answer. These are very generalized, right? So my disclaimer. Also, we're recording this. We've got to double check. So, you know, don't put any medical info in the chat. All right, so moving on. If you stay to the end, right, what we're going to do is we're going to do a special giveaway for those with perfect attendance. All right, you'll wait and see till the end to see what that is. All right, so my name is Dr. Paul Cachoa. If you don't know, I'm a physical therapist and owner of Par 5 PT. And I've been in the physical therapy field for over 20 years. I got my doctorate in 2010. And again, My goal is to help active adults get back to doing the things that they love to do without pain meds, injections, or surgery, so that you can feel better, move better, and play better. All right, so let's dive in. Again, stretches and mobility. We don't want to push through pain. We want to go slow, hold stretches for a prolonged amount of time, work on the breathing. We're going to touch on that as well, that the breathing is the first thing that you learned when you were born, right? First skill, first movement. When you can breathe correctly and tap into the parasympathetic nervous system, you can reduce pain and also allow a muscle that might be tense to relax as you go into the stretch. Yoga's got it right. Yogis know. All right, so this is from last week. You guys should know this video, and also from the week before. We look at this at a joint by joint approach. The body functions on this alternating pattern of stability and mobility. If that pattern is disrupted, pain or injury is the result. So particularly if we're looking at the lower back, we want the lower back to be stable. The joint above and below, the segment above and below, is your mid-back, your thoracic spine. That needs to be mobile, and your hips below that, below the lower back, has to be mobile. So if your body is missing mobility in your hips or mobility in your middle back, then the lower back is the middle part there, and your body will try and get as much rotation or mobility out of that segment when it should be stable. I mean, particularly for all my golfers out there, thoracic spine, you need to rotate through that. The hips, you need to rotate through that. If you cannot, you will try and rotate through your lower back, and there's not enough range of motion in your lower back in terms of rotation to withstand all the force that you're going to do with golf. All right, so these are the 3 pre-tests. We've done these every week, 3 pre-tests. We're going to do multi-segment flexion extension, hip flexor flexibility test. That's a review from 2 weeks ago, and the straight leg raise test. So this is the multi-segment flexion and extension. All right, what we're looking at here, you're going to all get up out of your seats, put your smartphone, iPad, laptop on the coffee table, and then we're going to stand up, get your feet together, knees straight, and then we're going to bend forward, like touch your toes. All right, the goal, passing, would be able to touch your toes. If you can't touch your toes, then we got to look deeper into that. I had another guy just come in yesterday who couldn't touch his toes and thought his hamstrings were super tight. And I got him on the table, tested out his hamstrings, and they weren't that tight. And we had to dive down deeper into why he had a problem thinking that his hamstrings were tight. We found out that his body was looking for stability. If your back, your spine, your trunk is not stable, it's going to look for that stability elsewhere. So it just cranked up the tone in his hamstrings and then made them feel tight, even though that they are long enough. So that's multi-segment flexion. Multi-segment extension, the 2 checkpoints are going to be the lower half of your shoulder blade should pass your heel. That's that one white line in the back. And the front part of your pelvis, we call that the ASIS. If you're in the business, we call that the ASIS. The front part of your pelvis needs to pass the toe line. So if you're going to do this on your own, I would, have somebody check you from the side and see if you are, put your hand out like that and see if you're past that line, the toe line and the heel line, when you do that multi-segment extension. All right, so those are the 2 tests. If you fail those, let's see what it could be. All right, so this one you should already know, right? Hip flexor test. It's basically sitting at the edge of a bed or a table. We did this week 1. If you missed week 1, you should go back and watch the replays. You hug one knee into your chest and you see, where does that other leg go? If that other leg does not go 90 degrees and the thigh is not parallel to the ground, you're tight, either in the psoas, which is a hip flexor, or the quad, if your foot is sticking out like that. All right, moving on, straight leg raise. So I got a video here. You're going to be lying on your back. We're going to use an imaginary line coming up from the knee. We're using the rig here as that imaginary line, and then you're going to raise your leg up. If your leg does not pass that line, then you fail the straight leg raise test. All right? So here we go. Some common stretches. What do you do if you fail those tests or there's pain if you did them? All right? Let's do a little bit of anatomy here, right? Find out what is the stuff on our back, the meat of our back, the paraspinals and the quadratus lumborum. Those are two that we're most interested in. The paraspinals go up all the way up and down the spine, right? Like shingles. They're just kind of like filet mignon up there. Now, the quadratus lumborum, if you look down deep on that bottom left-hand side, it's a little black, grayish muscle there, comes from the lower ribs down into your pelvis. That's your quadratus lumborum. That is one of the muscles that commonly gets tight if you strain your back, if you're having back pain. So how do we do that? How do we address that? We're going to work on maybe using a ball to mobilize that tissue. Now, the one thing is that if you are in pain, your central nervous system is at this certain level of threat. Say, something's wrong. All the red lights are going on. The alarms are blaring. So muscles get tight. You're more hypersensitive to pain, possibly, right? So if we're going to do this, we have to work on that breathing, like I mentioned before. Relax the muscle and reduce the tone. You want to make your inhale through the nose and then exhale, doesn't matter, through the nose or through the mouth with the exhale, but you want to make that exhale twice as long as your inhale, right? You reduce that level of threat, reduce that pain hypersensitivity dial in the brain, and then you allow that muscle to get into the meat, that lower back meat. And what I like to do is that when we get into that position, let me grab a ball here. Got it right here in my thing. So the one that I have quick to grab for you guys is this infinity ball. It's from Rock Tape. You're going to find the borders of the lower back, that quadratus lumborum. The border is going to be your pelvis, right? Your pelvis, your spine to the middle, and then your ribs. So somewhere between your ribs and your pelvis and to the side of your spine, that's where you're going to stick that ball. And then when you get on it, let's do this real quick. You get down, and then you just allow that to kind of sink in, that ball to kind of sink in there. And then once you find a spot, you move it around, you look for a spot that might be tight or painful. First, work on your breathing. You can notice that my knees are going to be bent. That gives a little bit of slack to the tissue. You're going to work on your breathing. Once you exhale and are able to relax, then we should start to move the hip, move the knee, pull the knee into your chest, or if that's too much, just let your knee fall out to the side. So we start to move the tissue with the ball in there to help release that. So we're kind of pinning down and stretching out that tissue. All right. The other thing I like to say is that if you have acute back pain, maybe not ice. I think that new research is out that ice, if there's not any inflammatory effect, ice is not good. Your body heals better with unweighted motion and compression on an area. But, you know, for the lower back, think about unweighted motion. Now we're going to go into that in a little bit. All right, so here's, again, a review. Hip flexor stretch. The hip flexor is attached to your lower back, dives down through the pelvis, and inserts into the front part of your leg, your femur. If that is tight, that is not going to allow your hip to extend. Let me show you this. There's a good picture here on the side. So you can see this. If that's tight in the front here, that's going to maintain this kind of partially hipped, flexed hip. You know, what that does is inhibits the ability for the glute to fire. Your butt muscle becomes inhibited. It becomes non-functional. And then where do you get your stability from? Where do you stand up? So what your body does is like, all right, I need to be vertical. I'm just going to go, and then try and get vertical from here. And what that does, it hyperextends your spine and then gets your lower back muscles on fire. It just kind of works. They get overworked and they get strained, and then they can easily go into spasm. You could tweak your back. All right, next, cat camel. All right, so this is one of the hallmark non-threatening, non-weight bearing movements that you can do for your spine, okay? So what we want to do is introduce movement to your spine. Put that away, but not in any way, not with any compression, right? So we're going to get on the table. Watch my mic, right? Hands are going to be below the shoulders, knees are going to be below the hips, and then we're going to work on sagging the belly to the floor and then rounding out the lower back and making sure that the pelvis moves. The pelvis should tilt down and then the pelvis should tilt up. The movement should come from here, which will allow your spine, your lower back to move. A lot of times I have people kind of just do one of these and feel like they're doing the cat camel. All right, so the quality and the technique is key as well. Now, if you are able to do that type of movement, then we try and progress it. We try and progress this non-threatening movement into what we call, into larger ranges, into what we call directional preference. Most of the time, if you're having pain and you pay attention to how it hurts, what makes it better, what makes it worse, you'll develop a directional preference where one direction makes things worse and one direction makes things better. So we kind of just lump it into bending forward or going backwards, bending or extending, worse or better. If you don't like, if bending forward makes things worse, then we go into extension. We go into extension, you try and push backwards and repeat that in a pain-free range, and you keep doing it. It's like a dosage, right? If you take 5 milligrams of a medication that's supposed to make you feel better, and it doesn't work, but it makes it a little bit better, then if you take 500 milligrams, you have a bigger therapeutic effect. You can do the same thing with this. If one direction or position makes you feel better and reduces the pain, but it doesn't last, then we need dosage, increase the frequency, and then work into the end range. Make your range of motion bigger and bigger. So we got a chat question here about your thoughts on exercises such as Russian twists. So Russian twists, I'm going to assume, are going to be in a kind of like a V position and taking some type of implement into your hands, or without an implement and just kind of rotating, right? So what's my thoughts? We just want to review what a Russian twist is. It's basically getting into this position and then doing one of these, or I could have my feet resting and then doing one of these, right? What is that? I don't know. I think the jury is out for that. I think if, and we're going to touch on this later, if you have the control of a certain muscle and you can turn that on well, then maybe Russian twists are okay. There's a lot of other ones that I would probably work on before I do a Russian twist. I like rotation and I like anti-rotation exercises. So maybe in replacement of a Russian twist, I would do like a half kneeling Palloff press with a rotation. Yeah, so it'll be like a band on the side. The Palloff press would just be coming out, kind of like a vertical plank. And then with the half kneeling position, it allows you to engage your glute more. And then you contract the muscles to kind of rotate over the foot that's out in front, the lead knee. I think in the, we might cover that in the next week's, or maybe 2 weeks. All right. So that is that. I hope that answers your question. It all depends. You know, I know a lot of smart people that say, all right, it all depends. If you do a lot of research, it all depends. But anyway, this is the muscle that needs to work. And this is the one muscle that people with chronic back pain have difficulty controlling. If you've seen people with like, what do you call it, weight belts or abdominal binders or a back brace, it's basically just this Velcro thing that wraps around and kind of cinches in everything. This is your body's own back brace. It's called the transverse abdominis. It is the core muscle. And if you do not have active control of this muscle, then you're using other things. Again, the body knows movement. It doesn't know muscle. So we have to make sure that if we're going to do an advanced abdominal exercise, we got to make sure that we got good control of that TA. So the TA is one of the deepest abdominal muscles. You got the rectus abdominis first, the obliques, second and third layers, and then the transverse layer is all the way down deep. It wraps around like a girdle. So here is a test to see if you are actually able to contract your transverse abdominis. You're going to lie down on your back. Knees are going to be bent. you're going to find your pelvic bone. It's really pointy. You could find it right on the edge there. And then you're going to put your fingers in to your belly button, digging in there, just about an inch from where that pelvic bone was. Now, from here, oh, I almost forgot. We got to check your breathing, right? So if you cannot breathe, you cannot function. So first thing is that when you're in this position, you put one hand on your chest, one hand on your belly. If we do quiet breathing, which hand, I'm talking at the same time, which hand moves more? If you're properly breathing, the upper hand should not move at all. The lower hand is the only one that should move. Abdominal belly breathing. Your diaphragm frames your lower half of your ribs right through here. So we know why we have to diaphragmatic breathe right into the belly, not into the chest. We're going to go back to the pelvic bone, dive in about an inch, put your fingers in there, and then pull your belly button into your spine. If we pull the belly button into your spine, you should feel that tension, that muscle pop into your fingers. That's the only place that you could feel that transverse abdominis work. If you can feel that tension and breathe at the same time, then we're good, all right? A lot of times people will start to create that artificial tension in their core by sucking in, by holding in their breath. If you cannot breathe, I'm getting a cramp. Just trying to do that, it's crazy. If you cannot breathe and contract the transverse abdominis, then we gotta look at it a little bit closer. All right. Actually, just because it felt engaged the lower back a bit, yes. Looking at a question here. Let's see here. I always do it anyways, but it's always, yes. I would say because anytime that you're doing like a V up or those Russian twists, the thing is there's a very heavy hip flexor component to that. And that's why people who do a lot of abdominal work with their legs elevated, they feel it in their lower back because their hip flexor is working so hard and shearing the back forward while your abdominals are trying to pull your back backwards in the opposite direction. So it's a tug of war, and the strongest muscle wins. All right, next one. All right, some core exercises. Here we go. So I like the plank, side plank, Palloff press. Yes, we're going to do that. I thought we were going to cover it. Wasn't sure. And stir the pot. So this is good. The proper way to do the plank, I showed that a little bit there. So real quick, a lot of times people go for planks and go for time, like a minute, 2 minutes. I don't know if that's functional, but I know it's difficult, right? But I think anything over 30 seconds is tough because it has to be an active plank. Pull your elbows in, pull your toes up, push your shoulders forward. That's more active and that's more difficult than just hanging out. All right, for 2 minutes. All right, so this is the plank. Oh, this is it, the Palloff press. I knew this was in there. I wasn't sure. So Palloff press, you got the band attached to the side. We're going to engage the core and push that forward, all right? So the Palloff press, actually in this video, if you go to my YouTube channel, the progression of the Palloff press would be that exercise that I just mentioned, the Palloff press with rotation. All right, and this is a nice one I like using the ball is stir the pot. Doing a plank, but doing an active plank. You're actually trying to move, manipulate your arms while trying to maintain a solid core. All right. And then, all right, post-test. Let's go through the tests again. Can we go multi-segment flexion, which is basically feet together, bending forward? Does the back round sufficiently? And then can you touch your toes? And then can you extend, get your pelvis past your toe line and the lower part of your sternum, your shoulder blades past your heel line? And hip flexor test, can we pass that? And then straight leg raise. All right, so bonus tip. Got 5 more minutes, see if we can get through this section. Bonus tip, if you failed the flexion test, I'm going to have you try this right now because this is like magic. It's a neuromuscular drill. So if you fail the flexion test, if you cannot touch your toes, what you're going to do is you're going to take a ball, you're going to lightly and repeatedly rub the underside of your foot 20 seconds each side. Light, quick rolling, both sides. All right, I'll wait. 20 seconds on one with a ball, 20 seconds on the other, and then retest. Right? If you retest, that should improve your standing bending range of motion. If it doesn't, shoot me a chat, or if it did, shoot me a chat. Either way, I want to know if it works. Every time that I try this, it works for me. Try it out. All right? The next one, bonus tip, if you fail the straight leg raise test, if you're lying on your back and you can't get your leg to 90 degrees or past the knee line on that other leg, then it might not, your hamstrings, are your hamstrings tight, or do you have a core motor control? So this is one of the big ones that I see with a lot of people who perceive tightness in the hamstring, but I do the test, the straight leg raise test or the passive straight leg raise test, and they pass. So this is one of the ways. If we engage the core, we've got a band attached overhead. We pull the band down. That's going to engage your core. If we actively engage that core, you should be able to move your limb, right? Your body developmentally works that way. It has to be stable in the center, this midline stability, before your brain says, okay, move your arm in this direction or move your leg in that direction. All right? And let me see, can I get my cursor back here? Yes. All right. Pain is an experience. All right. Pain can occur in the absence of tissue trauma or damage. It is complex. The brain is the key. I had an instructor once say that the brain is the most powerful virtual reality machine out there, right? So your brain can play tricks on you, right? But it doesn't mean that it's tricking you with pain. Your pain is there, but there are many, many studies that show that you don't have to have something torn, something broken to have pain, all right? How do you explain phantom limb pain? If somebody has lost their leg at war or they're an amputee, they still feel sensation in that limb even though they don't have it. There's a lot of factors that go into dictating whether or not you have a lot of pain or not a lot of pain. Biological, psychological, social, behavioral, stress, fatigue, hydration, all those things play into how you experience pain. This is a picture of a homunculus. It is a brain map. This is how your brain perceives your body. So you can see how large the hands are. The one on the left is how your brain senses, right? So the hands are bigger, the lips are bigger, the face is bigger, tiny legs, tiny back. You don't need that many nerves in that area to sense the skin or sense that sensation, but you do need a lot more hands. And the one on the right is motor. So you control your hands more, control your mouth, control your lips. So this is how your brain perceives your body. When you have pain, this whole map, this perception can get smudged. Like you pour like ink all over a paper map. You lost sense of direction. So that's what pain does. So, imaging may not be relevant when somebody has pain. When somebody comes to me and they have an X-ray, an MRI, the disc, or the report, I don't look at it. I acknowledge that they have it, but I do the physical exam first, and then I look at the MRI results and see, does it make sense, all right? Red flags, if you have numbness in your perineal area, down low, if you have loss of bowel and bladder control, or recent unexplained weight loss and gain, those are emergent medical issues that might be tied to your spinal cord, your spine. Go get that checked out. But in the absence of those things, X-ray results sometimes, or MRI results are not always connected 100% to how someone presents. Someone could have a small herniation and have a lot of pain, or have massive herniations all over the back and have nothing. Seen it either way. So, but if you are dealing with back pain and soreness, come schedule a discovery session. It's a free consultation. It's not an evaluation, right? But let me explain a little bit. So it's about 30 minutes long. It's not a full evaluation. It's not a creation of a full plan of care, but we have a deeper conversation about what your pain problems are. And at the end, you can make an informed decision of whether or not that we would be a good fit and if I could fix your problem. All right. So you could contact me via the number, the email. You could put it in the chat box if you want one. I only got like a couple each week available because I don't want to take away from all my paying clients, but this is free. And if you're dealing with pain, I don't want you to deal with pain anymore. All right. I know how much back pain can suck. So contact me. We'll find out what exactly is the problem and if I could fix it. Let's see here. So let's recap what we learned. Soft tissue mobilization. That's the ball. You put that in the quadratus lumborum, the low part of your lower back there. Work that out. You're going to try and do that for 2 minutes. And then the hip flexor stretch. We did that. We reviewed that. Got to do it properly. A muscle can only stretch if both ends of that muscle are stabilized. So that hip flexor, the technique of contracting the core, contracting the glute, and getting that stretch properly in there is key. All right, cat camel, that's that non-weight bearing, non-threatening, active range of motion for your spine. And then we worked it into, common yoga poses like knees to chest, happy baby. The press up, that's a cobra, right? And I think yoga is great. Stretching and relaxing and breathing into positions that are sometimes perceived as pain is always useful to get you back to moving. We talked about the role of the transverse abdominis, the TA. We talked about the core exercises. And for those of you who continue to attend each session, this is a surprise. You'll be entered in a raffle for this, the Trigger Point MB Vibe vibrating massage ball. All right, you got to have perfect attendance. I'm sorry for people who have signed on just for this and haven't gone to the knee or the shoulder, but we do have people right now who are in the running. I could see the names, and yes, at the end of the 6 weeks, I will be giving this out to somebody. But you know what? I don't want to leave you guys in the dark, but for now, I'm going to give away a pair of rock balls to a random attendee tonight. All right, so I got your names, and we're gonna make a drawing by Friday, and then I'll notify you by email. All right, so this is 2 balls. We got one that's spiky, which is more sensory. You can kind of reduce pain that way with just light rolling on an area, or you can go deeper with the flat round one. It's like kind of like a lacrosse ball. So we're gonna give away to one lucky person who's in the room tonight. You're going to get one. Check your email box by Friday, if not by tomorrow. All right. So I want to say that we are halfway done the series. All right. This is number 3. And these are the goals that I want to be able to attain by the time that we're all done for you guys. Now, I want to let you know that we're not going to be meeting next week. We're going to meet in 2 weeks. We're taking a week off next week, because next week, Wednesday night, I've got to teach another course separate than this one. So October 7th is going to be the neck. We're going to continue with the neck, October 7th. This is the halfway point. I congratulate you guys for making a decision to attend and listen to me ramble on for half an hour, 34 minutes now. And hopefully you guys can gain something out of this. This is helpful and useful. So please, my question right now is, how can I make this any better for you? How can I improve this? Any comments or criticisms, let me know in the chat, or you can text me or email me or whatever. If you want to take advantage of the discovery session or have any issues, critiques, comments, feel free to reach out. All right. I thank you, everyone, for hanging out. We ran a little bit over. I try to keep these under 30 minutes. 35 minutes right now. Thank you so much. I'm going to stay online if there's any questions.